Ladies, we need to talk, and I need you to really listen closely, because the way you dress for your doctor's appointments might be quietly hurting the quality of your care, and even your health. Yes, truly. And no, this isn't about vanity. This is about respect, about clear communication, and about how you're treated by the very people whose job is to take care of you. We'd like to think our appearance doesn't matter in a clinical setting, but in reality, humans, doctors included, are influenced by the signals we send without saying a single word. Before your next appointment, I want you to stay with me all the way to the end of this conversation. I'm going to walk you through the 7 mistakes I see far too many older women make when dressing for medical visits, and exactly how those choices can end up costing you in ways you might not expect. We'll talk about how these missteps can cut into your appointment time, affect the thoroughness of your exam, and even shape the way your doctor interacts with you. And don't worry, I'm also going to tell you what to do instead, so you walk into that room feeling comfortable, respected, and ready to advocate for yourself. If anything I say today hits home for you, do me a favor. Click the like button, subscribe so you never miss these important conversations, and share in the comments. What do you usually wear to your checkups? All right, let's get started. Let's start with something we don't talk about enough, what I call the invisible syndrome. The truth is, society doesn't exactly roll out the red carpet for older women. The older we get, the more the world seems to look past us. And in the medical field, this has a name: age-related bias. Yes, it's real. But here's the part many people don't realize. Sometimes, without even meaning to, we feed into that bias ourselves. I've seen women, brilliant, kind, full of life, show up to their doctor's appointments wearing oversized sweatpants, worn-out house slippers, hair piled in a messy bun, eyes cast downward, and avoiding much interaction. Do these women deserve respect no matter what? Absolutely. But here's the reality. Doctors, nurses, and every person in that clinic are human. Whether they mean to or not, they pick up on cues. The way you dress, your posture, even your tone of voice. These silent signals tell them whether or not you expect to be heard, respected, and taken seriously. When you walk into that office looking like you've checked out, they may treat you as though you have. And I'm not saying you need to arrive in designer clothing or high heels. That's not the point at all. But if you show up looking clean, put together, and present, you send an unspoken but powerful message. I am still here, and I expect to be treated with care and respect. That message matters, not just for how others treat you, but for how you see yourself. Because when you carry yourself like you matter, something shifts inside you. You stand a little taller. You speak up more. And believe me, your doctor notices. The next thing we need to talk about is something far more practical, but it makes a huge difference to the quality of your care: clothes that make it difficult for your doctor to examine you. I see this almost every day. Many older women, often for warmth, modesty, or just habit, arrive at their appointments layered up. A thick sweater over a turtleneck, a snug compression garment underneath, or even a one-piece jumpsuit that feels cozy but takes 5 full minutes just to get off. Now imagine this. I need to listen to your heart, check your lungs, press gently on your abdomen, or look at a skin rash. But I can't easily get to those areas because your clothing creates a barrier. Every extra minute spent removing or adjusting layers is a minute taken away from discussing your symptoms, answering your questions, and making sure nothing is missed. And here's the bigger issue. In a busy clinic, if something is too difficult to access quickly, there's a real risk it might get skipped altogether. Not because your doctor doesn't care, but because time is tight, and the priority is keeping the appointment moving. That can mean delayed diagnoses, incomplete exams, or unnecessary extra visits and tests. This is why I always tell my patients, dress for the doctor, not the dinner party. Wear something that's comfortable and easy to work with. A loose-fitting blouse with buttons or a zipper. Pants you can easily roll up for a leg or knee check. Layers you can slip off quickly without feeling flustered. When you dress this way, you're making the exam easier and smoother for both of you. You leave feeling properly cared for, not rushed, not half-examined, and you've given your doctor the best chance to catch anything early. Now let's talk about something you might not expect: over-accessorizing. I'm talking about the jewelry, the shapewear, the decorative layers that are beautiful in daily life, but can become real obstacles in a medical setting. Think about all the little extras many of us wear without a second thought. Necklaces, watches, earrings, bracelets. They're part of our style, part of who we are. But in an exam room, they can get in the way. For example, if you come in wearing a long necklace that rests right across your chest, we'll have to remove it before placing the sticky EKG leads to check your heart. If you're wearing a snug underwire bra, it can make a breast exam more difficult, or even interfere with certain imaging. Then there's shapewear, Spanx, compression garments, or layered wraps. They might smooth lines under your clothes, but they also slow down urgent checks of your abdomen or hips. And I've seen it more than once. A woman struggling to remove a piece of jewelry or clothing because her hands don't have the same dexterity they once did. In an emergency, that delay isn't just inconvenient, it can be dangerous. This doesn't mean you have to show up barefaced and in a plain outfit. You can still look and feel like yourself. The key is choosing items that are easy to take off quickly if needed. Maybe leave the layered necklaces at home. Wear a bra without rigid underwire for that day. Skip the tight shapewear so your doctor can access areas without making you uncomfortable. It's not about losing your style. It's about putting your health first. The easier it is for your medical team to reach the areas they need to check, the faster and more comfortable the visit will be. For you, and for them. This next part can feel sensitive, but I'm saying it with nothing but care for you. Your personal hygiene matters, even in a medical setting, and not for the reasons you might think. When you arrive clean, freshly dressed, and groomed, even in something as simple as a cotton blouse and brushed hair, you're sending silent signals to your healthcare team. Without saying a word, you're showing that you're managing your daily life, that you're functioning well, and that you take pride in yourself. But when a woman comes in unwashed, with noticeable body odor, greasy hair, unbrushed teeth, or clothing that's soiled, it sends a different kind of signal. And I want to be clear, this is not about judgment or shame. It's about what those changes in self-care can mean medically. As doctors, when we see that someone's hygiene has noticeably declined, it often raises important questions. Is she depressed or struggling emotionally? Is arthritis or another physical issue making it painful or difficult to bathe or brush her hair? Are there early memory problems or cognitive changes affecting her routine? Is she living alone and quietly struggling without help? In many cases, hygiene is one of the first outward signs that a woman may be facing isolation, health challenges, or the early stages of decline, even if she doesn't see it herself. I've had patients where this was the very first clue that something deeper was going on, and because we noticed, we could get them the help they needed. So, even if you're just popping in for a quick checkup, take the time for a shower, brush your hair, put on fresh clothes. This isn't about vanity. It's about dignity, self-respect, and ensuring your doctor sees the healthiest, strongest version of you. It's a small step that speaks volumes, to them and to yourself. Now, Let's talk about something most women barely think about before a doctor's visit: your shoes. You might not realize this, but from the moment you walk into the waiting room, your doctor is already gathering information. As you walk from the chair to the exam room, we notice your stride, your balance, your posture. We're not being nosy. It's part of the clinical assessment. Those few steps can give us important clues about your strength, joint health, fall risk, and even your overall confidence. But here's what I see far too often: older women arriving in worn-out slippers, loose flat sandals, or ballet flats with no arch support at all. Sometimes they're so loose they're nearly slipping off with every step. Yes, they're easy to slip on. Yes, they feel cozy. But they also make you unstable. They subtly change the way you walk, throw off your balance, and increase your risk of tripping or falling. And here's the truth: one serious fall after 70 can change your life forever. From a doctor's perspective, wobbly shoes often mean a wobbly body. That tells me I may need to check your bone density, evaluate your balance, and talk to you about ways to prevent falls at home. So here's my recommendation: wear shoes that are comfortable but supportive. Look for a firm sole, good arch support, and a back strap or heel cup to keep them secure. Sneakers or walking shoes are ideal. You don't have to sacrifice comfort. In fact, the right shoes can make you feel more grounded and steady. When you walk into a clinic with stable, secure footwear, you're not just protecting yourself from injury. You're silently telling everyone in the room, I'm taking care of my body. I'm here to stay on my feet and stay strong. And that message matters. Now, this next one might make you smile, but I promise, it's more important than it sounds. Let's talk about the pajama problem. I've seen it more times than I can count. A woman arriving for her regular checkup wearing pajama bottoms, a nightgown, or even an oversized robe. And I want to be fair here. If you're very ill, recovering from surgery, or coming straight from the hospital, of course we expect you to dress for comfort above all else. That's a completely different situation. But I'm talking about the routine visits, the yearly physicals, the blood pressure checks, the follow-up appointments, where a woman walks in dressed as if she just rolled out of bed. I understand why it happens. After retirement, you're no longer dressing for work every day. You're not trying to impress anyone, and comfort becomes the top priority. So, you might think, why bother? Here's why. Because how you dress doesn't just affect how other people see you, it affects how you see yourself. Research in psychology shows that when we dress in a way that signals low energy, like pajamas or very sloppy clothes, our minds tend to match that energy. You may find yourself speaking less, asking fewer questions, or feeling less engaged in your own care. And here's the other piece: doctors and nurses are human. When they see someone dressed that way, they may, often unconsciously, assume you're not interested in details or that you're less invested in the conversation. That can lead to a faster, less thorough visit. But when you show up in clean, casual daytime clothes, something simple, like a comfy pair of pants and a soft cardigan, you send a completely different message. I'm here. I'm present. I'm a participant in my own care. You walk in as an active partner in the appointment, not just a passive observer. No one's asking for makeup, heels, or anything fancy. Just leave the pajamas at home. Choose something that tells both you and your doctor that you're still showing up for your life, because you are, and you deserve to be treated that way. Finally, let's talk about something that might surprise you: color. Because believe it or not, what you wear on the outside can quietly shift how you feel on the inside, and even how others respond to you. So many older women default to what I call background colors: black, gray, beige, dull browns. They feel safe. They feel modest. and there's nothing wrong with them. But here's the thing. Those colors also make it easier to fade into the background. They send a quiet message to the world. I don't want to be noticed. Now picture this instead. You walk into a clinic wearing a lavender sweater, a turquoise scarf, or a deep red jacket. Heads turn, in a good way. The receptionist smiles. The nurse leans in to greet you. You get more eye contact, more warmth, more human connection. I've seen it happen again and again. And it's not just about other people. Color lifts your own mood too. Wearing shades like plum, teal, rose, or sapphire can make you feel more vibrant, more confident, and more present. Even something small, a patterned scarf, a blouse in your favorite jewel tone, a pop of lipstick, can be enough to remind you I am still vibrant. I am still visible. I am still valuable. You don't have to wear anything loud or flashy. This is about adding just enough life to your look so that it reflects the life still in you. When you show up to your appointment with that quiet confidence, trust me, people notice. And not just notice, they respond differently. So the next time you're heading to the doctor, remember, how you dress is more than fabric and color. It's a message, to them and to you, that you still take pride in yourself, that you still expect to be treated with care and respect, and that you are still very much here.